Assalamu alaikum wa rahmatullahi wa barakatuh. In the language of peace and love, I greet you a very good evening. I'm Hawa Solomon. Welcome to another edition of Health Matters. Pancreatic cancer is up for discussion, and it is for the month of November. It's highlighted on the World Health Organization calendar. So please take note of that. Lots of information out there. We'll be talking to specialists about it. So we continue our wellness insert with Zaid Ishmael. Inspiring author, a mental health advocate, single dad, and a coach for life, Zaid Ishmael. We appreciate your time once again. Always a pleasure. Shukran for joining us. Assalamu alaikum to you.
Wa alaikum assalam wa rahmatullah. Jazakallah for having me again.
It's a pleasure. Always having your bright face on air with us, inspiring our viewers, alhamdulillah. Tonight's discussion is pancreatic cancer. We are highlighting World Pancreatic Cancer Day. What are your thoughts around the well-being of these patients that do have, any type of cancer?
I was just going to point exactly that out, is that cancer across the board has some very common underlying themes. And the one thing I can say for certain, and this is through experience with engaging with people that have been afflicted with cancer over the years, is that the one consistent theme is that there is a very, very deep grief that a lot of them carry with them. And it's not necessarily a grief related to the present moment in their life. It's usually about something from the past that they haven't reconciled yet, or would want to have reconciled, but hasn't been possible. And the reason I raise this is because our body responds to this heaviness that we carry with us for such a long time, and eventually it manifests as illness. So pancreatic cancer, it's like all cancers, it's terrible. But understanding what is that underlying emotional stress that we introduce can significantly reduce the impact of the cancer and how difficult it is for us to deal with it. Because, as you know, sorry, just very quickly, one of the things that always comes through is that we need to always remember that stress is one of the biggest causes of illness, especially chronic illnesses. So just with that as the underlying thought, we need to just keep that at the back of our minds throughout tonight's discussion.
Yeah, and looking at, dealing with stress and depression, possibly depression, because that would, then be categorized as clinical depression. Does one then go through mild symptoms of depression when it comes to, having a chronic illness? And how does it actually affect the management of dealing with a chronic illness like that needs the necessary therapy, even surgery for that matter?
To focus on the depression side of it first, depression is unfortunately horribly misunderstood because we often position it as if it's something that happens to us, when it's not really something that's happening to us. It's something that we're experiencing in response to what is happening to us. And that's a very critical shift, because when we talk about depression, people start thinking brain scans, and they think of chemical balances, and they think of antidepressant medication and things like that. But it's a lot simpler than that, but a lot more profoundly impactful on our lives if we just stop and think about what causes it. Depression is a combination of two things, and I'm going to oversimplify it because we push for time. The two things that underlie depression is that we've had a sustained period of failed expectations, right? And that failed expectations is usually relative to one specific important area of our life. It doesn't have to be every area of our life, so we can't say that we don't have a sense of hope in everything. It's about something that is crucially important that then impacts everything else in our life as well, the quality of our life. And that brings me to the second point, which is the absence of hope. So the moment you have this frustration of believing that your expectations are never going to be met or fulfilled, and follow that on with the hopelessness that results from that, that sets you down the path of despondency and then depression. And when you experience a depression, because you've been doing it for such a long time, feeling that way for such a long time, it becomes a subconscious kind of normalized stress that eventually you forget is even there. And then you just believe that you're depressed, but you're not just depressed. It's because there's something that has been unresolved for a long time that you've lost sight of.
Looking at the hopelessness and understanding it, what would you describe the duration of that feeling should be, or could possibly be, that you could, then understand the symptoms and the signs of depression when, partnered with the chronic illness and dealing with it? Is it a week, 2 months, a month, when it comes to that feeling of hopelessness? And how does one manage it?
The important thing to recognize is that there is no time frame for it. It's like there is no time frame for grief. There is no time frame for recovering from loss or betrayal. It's all about what it is that we take from it and what it is that we need to have reconciled about it that holds us into that space for a long time. What makes it bearable and what makes it sustainable over a long period is that we find limited joy or limited optimism in other areas of our life. So say, for example, and I'm going to use this as an example because it's one of the most common causes of depression. If we have strained relations within our families or within with someone significant to us, right? That strained relation is not something that directly impacts every area of our life, but our quality of life in every other area is impacted by it because of the sense of significance that we get from it. So the more significant we feel, the more confident we are in the other domains of our life, and then we kind of get better overall and we have a better quality of life. Now, if that strained relationship is so contaminated and so important to us that it starts affecting our sense of significance, our sense of self, what happens then is that we start withholding. And we start withholding ourselves in the different domains of our life. And by that way, what happens is that even though we still might experience moments of success and effectiveness in different areas like work and recreation or whatever else it might be, social as well, the fact that there's an underlying sense of insignificance, of weightiness, that will detract from it. So we'll maintain that for a long period of time until we either reconcile it in our minds about what we can take differently from it, or we can reconcile it with the person that it actually relates to.
So how do family, friends, and a possible support system help that individual to not fall into the hands of depression, and there is this heavy burden of cancer on them as well?
The important thing to remember is that as much as the family and the support structure around the person is affected by it, they need to remember that it is most impacting the person who is afflicted by it, the person who has the cancer. And the person who has the cancer needs to, one of the most critical things for people who are suffering from cancer is that they often have, and I'm saying often because based on different people that I've engaged with over the years, they often lose sight of treating themselves kindly, thinking of themselves kindly, giving themselves a benefit of the doubt, recognizing their worth compared to others. And as a result, the cancer just kind of adds on to that sense of self that has already been contaminated, which suppresses them even further or subdues their spirit further. And that just adds to the stress, and the stress adds to the physical illness. So to break that cycle, the people around them need to do two things. The one is they need to make sure that they focus on the mental health of the person more than they focus on the illness, right? And secondly, and this is a critical one and very sensitive one as well, is that the people around the person suffering from cancer should do what they can to have an informed opinion of what treatment options are available. But the final choice must be supported as the choice of the patient, not the family. The patient must have primary focus in what it is that they believe is going to be the best thing for them, because the one thing that any healthcare practitioner will tell you is that if you don't believe in the treatment protocol, it will lose effectiveness, or it will be less effective than what it can be. So it's critically important for the support structure around the person who has cancer to support them in what it is that they want for themselves through that recovery process or that response process. because that is what is going to keep their spirits in a healthy space so that they can see that there is hope out of all of it, rather than continue to feel as if they are hopeless in claiming their voice once again when everyone else around them is pushing them for treatment option A or treatment option B or whatever the case is.
Let's talk about a positive mind, body, and soul, and especially when your body is, thrilled with pain, and inherently you feel down. You just physically feel down because of pain through the necessary cancer or the specific cancer that you're going through.
That pain adds to that sense of hopelessness, right? Because it just adds to everything else. But the one thing I can say with absolute certainty is that cancer is not a death sentence. And this is something that a lot of people, in fact, a lot of people that have had cancer asked me about this up front. Like, they've been given X number of weeks or months or years to live, and what now? And the first thing you need to recognize is that you've been given that duration based on your current state and your current circumstance and the current options available to you. The moment you choose something that breaks the cycle of where you're at, it changes that outcome completely. It changes the probabilities completely. And when you focus on the pain, you focus on the illness, and you focus on everything that's wrong, all you're doing is you're feeding the cycle that got you into that state in the first place. So what you need to do is you need to recognize what are the options, what can be reversed, what can be changed, what can you do differently. Focus on quality of life. Quality of life, quality of relationships is the most important thing at that point. And once you start improving that, everything else feels lighter, and then you start seeing opportunities for how it is that you can recover from this, rather than looking at what you need to get in place before this thing overwhelms you.
Shukran so much, Zaid Ishmael. That's where we have to leave it. Appreciate your time once again. Connect with zaidishmael.com and his various positive self-help online and group facilitating areas. And he's definitely someone that you need to connect with if you need that positive vibe within yourself. Always a pleasure, Zaid. All the best. Assalamu alaikum.